Okay, Dr. Shaw, I'm muting myself and you're going to be live. Hold on.
All right. Good morning, everyone. I'm Dr. Shaw. I'm with UCLA, and
not yet, Dr. Shaw.
Oh, are you gonna cue me or?
Yes, I'm gonna cue you. Hold on.
Okay.
Just a second.
I was like, I don't know. I'm just gonna go.
Okay,
Thanks.
just a second. Okay, Dr. Shaw, the floor is yours.
Great. Thank you very much. Good morning, everyone. My name is Dr. Shaw. I'm with UCLA. I'm a primary care physician. And it's a great honor to be here. Thank you for having me. I have to admit, putting this presentation together forced me to also step back and check in with myself. So it's a great opportunity for me as well to be able to give this talk. You know, sometimes we just need a day or an event to force us to break our routine. And I find that often we're just so used to the go, go, go that we get used to it. And introspection is so important in days like this. It's great when we're able to do so. My hope is by the end of the presentation, the audience will be also able to step back and identify one positive change that can be made to help us navigate through this pandemic. So the topic of today's discussion is COVID-19, navigating the pandemic. And the question is, you know, how can we care for ourselves and others during this time, making our health a priority? And I see women and our role often as an inverted pyramid where we're often at the base. And though we may or may not have help, we still play such a big role in the day-to-day decisions and are often made by us. Think of all the hats that we wear. You know, we're daughters, we're professionals, we're mothers, partners, a boss or an employee, caregivers, cooks, cleaners, the list never ends. And where in all this do we have time to take care of ourselves? There's just not enough hours in the day, right? Or at least it feels that way. So, you know, you have a little bit of my medical background, but to further paint the picture, let me give you an idea of all the hats that I wear. So in addition to being a physician, I'm also a wife. I am 35 weeks pregnant, which adds to the complexity of navigating through the pandemic. I am an only child, and in many ways, I'm also a caregiver to my father who was diagnosed with ALS. And more so, in addition to all that, I am also a woman trying to navigate the pandemic, and we're all in this together. So let's move forward and see what we can do to help ourselves and help those around us. Give me 1 second, just trying to, here we go. Okay, so I have no financial disclosures. Let's start with discussing the pandemic. So a pandemic is an event in which a disease spreads across several countries and affects a large number of people. There have been many pandemics. We're not isolated. The one we're going through currently is not a unique experience. The most memorable, of course, is the 1918 Spanish influenza, which affected almost a third of the world's population at that time, with the mortality rate of about 50 million people. Of those 50 million, about 675,000 were from the United States. If you compare that to today's statistics, in the US, we've lost around 721,000 individuals. So we are definitely passing the Spanish influenza's mortality rates. There have been several pandemics since then. There was one in 1957, 1968, and probably the one you guys remember most recently, 2009 with H1N1. There's many factors that influence how far a condition spreads. So the two most important are how easily the condition is transmitted from one person to another. And the other factor that influences how far a condition spreads is the movement of people. So you can imagine in this day and age with airplane travel, how easy it is for particles to be transferred from one part to the other within just a matter of hours. So let's talk a little bit about the virus that's causing all this. It's SARS-CoV-2 that causes COVID-19. It's associated with the outbreak that originated in Wuhan and causes severe acute respiratory infections, among many other symptoms and conditions. It is a coronavirus, which is not novel to our environment. Coronavirus is also part of the viruses that cause the common cold, in addition to rhinovirus. But what's important, what I want to emphasize here is how transmissible it is and how it transmits from person to person. So there's three main mechanisms that we suspect. The most common is person-to-person respiratory transmission, meaning close contact with another individual. Usually that means within 6 feet of each other. What happens is the viral particles get secreted, and when an infected individual coughs, sneezes, or even talks, they can pass it on. The other mechanism is by touching contaminated surfaces, and then subsequently touching our own mucosal membranes. So that would be our eyes, nose, mouth. At this time, at least, it's not suspected that this is a major source of transmission. And the third, which there was a lot of uncertainty about, but we now know is a possibility, is airborne transmission. And this is when an inhaled particle stays in the air over time and distance. Again, the contribution to this as a mode of transmission is uncertain. We know it's possible, and we see it especially more so in areas where there's enclosed space and poorly ventilated areas. What's also important to know is that asymptomatic transmission is possible. And so that's the tricky part, and that's partially what makes this virus difficult to contain. About 33% of people with SARS-CoV-2 never develop symptoms. And the greatest example of that is the cruise ship, where they tested everyone on the cruise ship. About 58% of the individuals on of the 712 individuals on the that had confirmed cases were asymptomatic at the time of diagnosis. So this is important because you can imagine if you're asymptomatic, or if I was exposed and don't have any symptoms, I may go to visit my parents. I may go to work or a grocery store and not know that I do have the potential to pass on the infection to those near me. And the incubation period seems to be about 7 days. So asymptomatic means that you never develop symptoms, and that's different from pre-symptomatic, which is that you're exposed and a few days later you develop symptoms. And we're seeing now that that can be anywhere from 7 to 14 days. So again, this is important because how do you get a control of a virus that you may or may not know you even have? And that's where some of these preventative strategies become extremely important. And that includes wearing masks, hand washing, maintaining social distance, and vaccinating when possible. So let's take a look at the relevance. I was unable to find up-to-date data on Carson. The most recent I found was back in February, and we've had another spike since then. So unfortunately, that data wasn't as accurate, but I do have Los Angeles County, and you can see that the incidence, meaning the number of people that have been infected since the start of the pandemic, is about 4.8 million. And we have lost about 70,000 lives in LA County alone due to COVID-19. In the United States, you can see 44.7 million individuals affected with a mortality of 721,000. And in the world, greater than 200 million cases with a mortality of 4.5. And these numbers are probably an underestimation, as many countries don't have the ability to keep accurate logs of their cases. But if we go back to LA County, and we know that about our population is about 10 million, that means that since the start of the pandemic, almost 50% of the population at some point in time has been affected. Another interesting comparison is roughly about 40,000 women die from breast cancer every year and about 50,000 deaths from colon cancer. And if we compare that to the mortality just within Los Angeles County, currently COVID-19 has increased both of those statistics, or surpassed, I should say. So those are the people that get sick and potentially pass away, but there's more to it, I'm sure, in the media. You've also seen the long haulers. So what does that mean? The long haulers are individuals who were infected with the virus, may or may not have been hospitalized, but have persistent symptoms that continue beyond 4 weeks after they initially got sick. What I'm seeing in clinic in terms of common symptoms is fatigue, shortness of breath, chest pain, and cough. And you can see the range is pretty broad, anywhere from 15 to 87% of people continue to feel tired and exhausted. Shortness of breath about up to 71%, and chest pain up to 44%. Other symptoms include headaches, joint pain, a lot of anxiety, sleep disturbances, mental cloudiness, and body aches. Most often I'm seeing that these symptoms do slowly improve over time, but the resolution seems to vary. Again, this virus is quite unpredictable in terms of who it affects and the severity of symptoms in those individuals, but it seems to depend on the individual's risk factors, how sick they were at the time they got ill, and what their initial symptoms were. And as I mentioned, you can be a long hauler even if you were not hospitalized initially. So we take all this into consideration and we see why this is important, why this is relevant for us and in our current day-to-day lives. And the bigger question is, well, what can we do, right? Because a lot of this feels helpless and we feel defeated in many ways. So what can we do to help ourselves get through the pandemic and take care of ourselves and each other? It takes me to the next slide. So in terms of taking care of ourselves, there's 3 things I want to focus on. First is hygiene. The second is vaccine that are available. And then third is self-care, including emotional, physical, and spiritual well-being. So let's start with hygiene. These are things that we know already and should continue to practice. So of course, hand washing, as I mentioned in one of my other slides, contaminated surfaces can be a potential mode of contamination or exposure. If we're unable to wash our hands, hand sanitizer that has at least 60% alcohol is just as good. Of course, covering our coughs and sneezes, avoid touching our face, clean and disinfect, adequate ventilation, wearing a mask, and physical distancing. The type of mask that we wear is important because a lot of times I see individuals wearing gator masks and they're too porous. They don't do a good job filtering respiratory particles. So you want a mask that is tightly woven and has multiple layers. And that helps to entrap viral particles better than one that doesn't. The other thing I would say is please avoid masks that have exhalation valves. These masks don't do anything to protect individuals around you as you're still able to blow out viral particles. So if you're sick and you're wearing a mask that has an exhalation valve, you're actually still spreading. And the goal in doing all these things, of course, and the rationale is to contain the infection. Of course, one, when you're symptomatic, but 2, when you're asymptomatic or pre-symptomatic. Second, reduce transmission rates in individuals as well. Let's move on to the vaccine. So this graph is interesting. I pulled it from the LA County Public Health website, and they've done a pretty good job keeping track of individuals, cities, and school districts that have been vaccinated, what the rates are, and then they also have done a good job keeping track of infection rates. So this chart shows it's divided by ethnic group, and you can see here that at the bottom, we have our Latinx community. They are coming up slowly in terms of vaccination. And below that, we have our Black and African American communities. And so we know and we see that there's low vaccine rates among minorities who also seem to be disproportionately affected during the pandemic. So that's an area for us to continue to work on. So which vaccines are authorized for use? There are 3. There's the Pfizer and Moderna, which are both mRNA vaccines. The Pfizer has been FDA approved. Moderna is still in process. And the Johnson & Johnson is a more traditional vaccine. It's a viral vector. All 3 of them are effective at preventing symptomatic COVID-19 infections. The Pfizer also has been approved in 12 and older. And actually, it's a 2-dose with recommendations of a 3rd dose. Moderna is still a 2-dose, and the jury's out as to whether or not a 3rd dose will be needed. And Johnson & Johnson will actually find out today. It's under review by the FDA whether or not they see utility and benefit in making it a 2-dose. It may increase the efficacy to about 94%, but more info on that probably by the end of the day today. How do the vaccines work? So the mRNA vaccines, which are Pfizer and Moderna, basically they send a message to your body that has a code, and that code is to produce what's known as the spike protein. The spike protein is located on the surface of SARS-CoV-2. And so as a result of that, your body starts to produce antibodies as it sees the spike protein as a threat. And the antibodies' role is to protect your body. So if you were to ever be infected with SARS-CoV-2, the antibodies, which you can see here, the yellow Ys, they basically block the virus from entering your cells. So if this is the human cell, the virus cannot enter. And if the virus doesn't enter, it is also then therefore unable to replicate and can't make you as ill. The Johnson & Johnson does something similar, except instead of using mRNA technology, it uses a more traditional route of introducing the spike protein, which is the use of an inactivated cold virus. So the cold virus gets introduced. It does the same thing, which it carries the gene for the spike protein, and that subsequently mounts an immune response, produces antibodies, and prevents infection. This data basically shows that all 3 vaccines are efficacious. And rather than focusing on the percentages, which it's difficult to do because they were all studied at different parts during the pandemic, so they can't truthfully be compared to one another. But what's important to recognize is this last 100% here, which is that all the vaccines are 100% effective at preventing hospitalizations and deaths related to COVID-19. And, you know, in all honesty, I don't know that we will be able to eradicate SARS-CoV. It may end up just being a virus that exists in our environment, similar to a lot of other viruses. The goal is, of course, to prevent morbidity and mortality. So we don't want people to get extremely sick and or pass away as a result of infection. But more so than that, we also want to decrease the risk of hospitalizations and severe illness. And it looks like, based on the data, that all 3 of them are able to do that. What I can also tell you is that now with current hospitalizations, most of the individuals who are hospitalized at this time are those who have been unvaccinated. It's not to say that you cannot get COVID-19 even if you are vaccinated. There are some breakthrough cases, and that depends on the individual's own immune system, their risk factors. With that being said, what we're seeing in an outpatient setting is those individuals also seem to have more mild symptoms, often presenting as mild cold, or flu-like symptoms or a sinus infection. So we're happy, and it seems that the vaccine is helping to decrease the strain on the hospitalizations and the number of individuals that are passing away as a result of the infection. A lot of times patients ask if it's better to get vaccinated or contract the virus naturally. And it is, as with everything in medicine, a personal decision. And with everything in medicine, it's a risk versus benefit analysis. But what I can tell you is if you get vaccinated, the vaccine cannot give you COVID. It's not a live vaccine. And yes, you may experience sore arms, chills, headaches. Some individuals are experiencing dizziness or vertigo, or maybe heart palpitations. But what I call that is controlled chaos. We know it's going to happen, or it may happen. And we know that most often it goes away within a week, versus someone who actually contracts COVID-19. As I've mentioned, the virus is very unpredictable. It can make you very sick. And as we're seeing with the statistics, it can be very deadly. The other thing we know is that if you get the virus naturally, it seems to trigger a lot of inflammation in the body. That inflammation can be harmful or damaging to your body's own cells. And in addition to that, we talked briefly about the long haulers. So you may survive it, but there is still 25 to 33% chance that you may have persistent symptoms even once you're better. And we've had over 400 million doses of the vaccine administered by now, and we're seeing that people are doing overall really well with it. Of course, always talk to your doctor if you have concerns. They can go over the risk versus benefit profile and what to expect. But it's definitely something that's worth considering as a tool to help us get through this pandemic and keep us safe. Other questions that I've been asked is, can the vaccine cause infertility or sterility? There's no data to indicate that this is a possibility. mRNA gets dissolved, it doesn't enter your cells. It has no ability to change our DNA or genome. The other question I get asked frequently is, can you get the vaccine if you're pregnant or plan to conceive? And yes, you can. Again, you want to just talk to your OB or your primary to make sure you don't have any contraindications to receiving the vaccine. But we are seeing an increased number of pregnant individuals that are getting infected. We don't think, at least right now, that pregnancy in and of itself increases your risk of contracting the virus, although pregnancy is considered to be an immunocompromised state. But we are seeing that the risk of complications seems to be higher in our pregnant patients. There was a study done, there's been two major studies done. One that looked at individuals who received the mRNA vaccine pre-conception up to 20 weeks of gestation and compared it to the general population. And they found that the miscarriage rate between the two groups was similar. So getting the vaccine did not seem to increase the risk or rates of miscarriage. The other thing, this is just a side note, but if you're pregnant and have children at home, it's also important to exercise caution, because what we're seeing is that children seem to have very mild or almost no symptoms and are serving as vectors. So they carry the virus and transmit it often within the household or to grandparents, and they never develop any symptoms. So it's hard to tell that they were infected. But again, if you're pregnant, you just want to heed caution. And this is another example where wearing a mask is extremely important. Of course, it's hard to do that when you're at home within your own household, but doing it outside of the home, and if your child is able to wear it at school, would be super important. And again, vaccination in this instance helps as well, because it helps to reduce the risk of transmission. I can tell you also anecdotally that I received dose 1 and 2 early in January when it was first offered to healthcare providers. And that was a decision, I talked a little bit in the beginning about all the hats that we wear. And these are not easy decisions to make for anybody. And the decision to get vaccinated back in January was really based on being a healthcare provider and keeping my patients safe, and also me being able to see my parents as safely as possible. But I can also tell you that about 2 weeks ago, now in my third trimester of pregnancy, I received the booster as it became available to healthcare providers. And the symptoms that I experienced were a fatigue for about 48 hours, arm pain, and chills for about 24 hours. I did well with it, but I'm grateful because I wanted to make sure that I was able to do a small part to pass antibodies to the fetus before it was born. So again, a scary decision, definitely not saying that it was an easy one. But I'm happy that I did it because, again, being in medicine and seeing patients, I want to know that I'm keeping my patients safe and I'm doing what I can to keep my family and community safe as well. And also, a lot of times women ask if it's okay to receive the vaccine if you're breastfeeding, which yes, there's no data to show that that there's any contraindications to breastfeeding and being vaccinated. So let's move on to the last part, which is self-care. And the first part of self-care is addressing our chronic conditions. So there are many risk factors for poor outcomes as it relates to COVID-19. Of those, we're seeing a BMI greater than 30, so obesity seems to be a major risk factor. Diabetes, high blood pressure, individuals who are immunosuppressed, individuals that have chronic lung conditions, heart conditions, and smokers. And so again, in the time of a pandemic, there's a lot that feels out of our control, but it's important to step back and recognize what we do have control over and working on our own health, such as addressing our A1C, making sure we have adequate sugar control, making sure our blood pressure is under control, staying active and exercising, working on smoking cessation are all things that we can do. The next part is prevention. So what can we do from a preventative standpoint? So these are the things that we all hear and we all know we need to do and are very hard, again, with all the hats that we wear. It's difficult to know when and how to implement some of these things. But we did see that the amount of alcohol consumption increased significantly during the pandemic. Alcohol consumption as it relates to fatty liver, liver inflammation, it also affects our ability to get good REM sleep, can affect our overall health. And in fact, it does in many ways that we actually don't see directly. Also for nutrition, limiting sugar intake also helps. Maintaining a regular sleep schedule, exercise. This is one, in all honesty, I struggle with just because you get home at the end of the day and you're exhausted. You're still thinking about the charts that you may need to close or the work that's pending, or taking care of the kids when you get home, preparing dinner, so many things. But exercise, we often visualize it or think of it as a 30-minute block or going to the gym. But just know that it doesn't have to be that way. There's data to suggest that even 10-minute bursts of exercise and increased heart rate are beneficial. So if you can integrate that throughout your day, it helps. The other thing that's interesting about exercise is the short-term benefit. You get an instant release of dopamine, epinephrine, serotonin, a lot of feel-good hormones. And in fact, what happens is it helps us cognitively in the short run. We are able to focus and think more clearly after even 10 minutes of exercise. So if you're able to do a brisk walk on a lunch break, if you're able to park farther at the grocery store, or when you get home, even if you do 10 minutes, all of that adds up and makes a difference. And of course, the long-term benefits in terms of cardiovascular health, we already know about. Healthy weight, we talked about. Avoid neglecting chronic conditions, which was the previous slide, and then preventative care and screening, which I'll come to in my next slide. Let's see. So preventative care, one is seeing your physician once a year to make sure that they are keeping track of all your preventative healthcare needs and you're up to date. This includes for women 40 and older screening mammography. So screening mammography for the detection of breast cancer is indicated in anyone from 40 to 50 years of age, depending on what your risk factors are. Other screening opportunities, cervical cancer in the form of pap smear, colon cancer screening, and there's different ways to screen for colon cancer, ranging from colonoscopies to stool tests. And if you're a smoker, lung cancer screening may also be an option for you. But just some interesting data on why screening is important. And a lot of women have held off on screening during the pandemic for various reasons, ranging from, no access to their physician or, nervous to go into a healthcare system, which is totally understandable. Also lack of resources or diminished resources during that time. But things have opened up and I think most healthcare settings are running back at their full capacity. But what we're seeing as a consequence of delayed healthcare is that the rates of invasive cancer and metastatic cancer have increased substantially. So that's scary and unfortunate because early detection increases survival rate and treatment modalities. So if we look at even just cervical cancer screening, we know that doing a PAP every 3 years actually reduces the rate of invasive cervical cancer by 91%, which is amazing. I mean, if you get a PAP every 3 years, and if you do have cancer and it's caught early, your survival rate and the risk of it being something invasive is much, much lower than if you don't get routine screening. Who qualifies for lung cancer screening? So lung cancer screening is available for anyone who's 55 to 74 in good health. They have to have at least a 30 pack year history of smoking. So that means about a pack of cigarettes per day per year for about 30 years, or 2 packs per day for 15. Your physician can help calculate whether or not you qualify. Colon cancer, I want to touch on this one, is super important. I read an article just this morning that we are seeing a much younger population not only being diagnosed but passing away from colon cancer. Before, our screening recommendations were individuals 50 and older. That has been pushed down to a lower age to 45 because the rates of cancer in our younger population has exponentially increased. So if you're not able to get a colonoscopy, know that there are other ways if you're a low risk individual to still get screened. The FIT test is a good alternative, which is a stool test you would submit and collect and submit at home. And if done annually, has a pretty good sensitivity, meaning if it's negative, it's pretty reliable to that of a colonoscopy. Now, if you have risk factors like family history or a change in bowel movement, you do want to let your doctor know because the stool test may not be a good option for you. You may want to opt for the colonoscopy instead. But it's important to keep up with all of these preventative things because, again, we want to improve our overall health, but also early detection to reduce the risk of complications or metastatic disease. Also, with the pandemic, we can't ignore or put aside mental health. The rates of anxiety and depression have increased significantly and definitely understandably so. So, the symptoms can be physical, they can be emotional, they can be behavioral, and oftentimes we just push them aside because there's too much to do or we don't recognize that they are symptoms of anxiety and depression. So if we take a look and see here, what are the physical symptoms? And that may include increase in the number of headaches, sleep disturbances, worsening fatigue, trouble focusing or concentrating. Emotional symptoms can range from mood swings, which is a common one. We often don't think about that, But if you're noticing that your threshold for being irritable has decreased, it's possible that it may be a manifestation for anxiety and depression for you. Intrusive thoughts, not being able to stop worrying, feeling a sense of doom, fear that you're making constant mistakes, often are emotional manifestations of anxiety and depression. And behavioral symptoms can be isolation, social withdrawal, irritability, trouble concentrating, panic attacks. And at the bottom, I did put a little bit about children, just because our kids are also having a lot of trouble coping, and they manifest symptoms in very different ways. For them, we often see developmental regression, not wanting to go to school, their grades may drop, and or temper tantrums. So here's 2 screening charts. You may have seen them when you go in to see your physician. On the left here is our PHQ-9, which is a screening tool we have for depression. And on the right is the GAD-7. And you can Google these and find them online. They're very readily accessible. But I like it because it forces us to check in and just see how we're doing. And the idea is to answer these questions with how you have been feeling over the last 2 to 4 weeks. So if we take the first question, for example, little interest or pleasure in doing things, and you would mark 0 if you're not experiencing that symptom at all, or you would mark a 3 if you're experiencing that symptom every day. And at the end, you tally up the numbers, and your total score gives you a rough idea of where you are on the depression scale. And the same is true here with the GAD-7. So the first question on this side is feeling nervous, anxious, or on edge. And if you're not experiencing that symptom at all, you would mark 0. If you're experiencing it every day, you would mark 3. And again, you take the sum and a similar scoring scale. And it gives us an idea of maybe where we are. And if you are exhibiting any signs of depression or anxiety, please check in with yourself, your family, and or your physician to figure out what some of the best next steps may be for you. We also can't avoid discussing how the pandemic and COVID has affected parenting as it relates to sending children back to school. And that's a big contributing factor for even parents' own anxiety and nervousness and overall well-being. So I kind of look at this as the feel and breathe our way through it mentality, and that every day may be an experiment, and that's okay, we'll get through it. But what we know is the lack of predictability and the lack of control throughout the pandemic definitely equals increased anxiety. So in a time where, again, it feels like we have a lack of control, what can we do to increase our sense of control? So one is, reinforce your family's health habits. And this is, again, the masks, the hand washing, maintaining good distance and safe distances, not sharing food, understanding school protocols to help us feel more safe and more prepared. When I think of parenting during this time, the airplane analogy, I'm sure many of you have heard of, or at least been alluded to during this time, is so true and so accurate. And it's the idea that if there's turbulence or something going wrong, we put our masks on first, and then we put our masks on our children. And that's the perfect analogy for this entire talk, which is we have to take care of ourselves because we're the foundation in so many cases. And if we're able to take care of ourselves, then we can take care of those around us. Here, establish consistent routines that helps children maintain some level of normalcy. Have conversations about change with children. Instill hope. We may or may not feel that way. And some days we may feel more hopeless than others, but trying to maintain optimism, focusing on the greater good is so important and helpful. And it's it may just be a simple statement like telling our kids it's just the way things are right now, but it will get better. Or acknowledging that it is difficult for kids to wear a mask and, saying, I know wearing a mask is hard, but it helps us all stay healthy and safe. We have to model to teach. And so the idea is name it to tame it. So yes, I'm feeling nervous about this too. What can we do to make it better? Or what can I do to help you feel better? Our kids often rely on our own nervous system to help regulate theirs. And so if we have not been able to identify or are unable to identify our own emotions, they're probably also just feeding off of the same. And we can all work on it together. And this is one that I definitely struggle with, but believe that perfect doesn't exist, and that's okay. And that good enough parenting and good enough sometimes is what we need to function. Picking and choosing the battles, but importantly, seek support and give yourself permission to make mistakes. So in summary, tips to navigate the pandemic: acknowledge the turbulence. It is very, very real for everybody in different ways. But between social distancing, the loss of work, and our normal routines, there's a tremendous pressure on us physically and psychologically. So remember to check in with yourself. I had the opportunity to do that today as I went through the presentation. But also allow yourself to mourn. Know that this is a period of grief for many people, but don't forget to embrace what we can and do have control over. The next is keep chronic conditions well controlled. So by doing that, it helps to reduce the risk of infection and especially complications from SARS-CoV. See your doctor, it's safe. I promise they're doing a good job keeping the facilities clean and patients distanced. Prevention, fuel your body with healthy food, move your body. Don't forget, please don't forget about the cancer screening. You don't have to, exercise all at once, but every little bit does count and makes a difference. The next one is find ways to stay connected safely. That will help us to ease our own stress and find some ways to maintain a level of normalcy. And of course, find ways to stay optimistic and positive, and that will help with our well-being as well as our children's. And the last, of course, is vaccinate, social distance, and mask. And we know that if we're able to do those things, it may be worth it to help decrease the rates in the short term, and in the long run, help us to decrease transmission rates to not only ourselves, but our loved ones, return to work more safely, children to be able to return to school. And if you can't or medically are unable to, just continue to practice proper hand washing, hygiene, masking, and social distancing. So I wanted to end with some resources. I find apps, especially when we're busy, or podcasts can be really helpful. So the first three here, many of you may have heard of the first two, which is Calm and Headspace. The third is My Strength, which is an interactive wellness platform, and it provides a lot of self-care tools. So all three of these have been helpful. I can tell you, I use Headspace at night sometimes just for some mindfulness and meditation, and it helps to shut my mind off and kind of dissociate myself from work, versus being at home and being present with my family at the end of the day. There's some great resources in terms of books for children. A good one is What to Do When You Worry Too Much, A Kid's Guide to Overcoming Anxiety. For parents, there's one that's titled When the World Feels Like a Scary Place, Essential Conversations for Anxious Parents and Worried Kids, and that can be helpful as well. And there's several great websites. UCLA does have a mindful website. It's Meditations for Wellbeing, and it's free and open to the general public. And I've used these as well in the past. They range anywhere from a few seconds to a few minutes and have guided breathing strategies, again, really to help sometimes what feels like a racing mind shut down. The state of California and LA County actually has a lot of wonderful resources as well. If you click on the link, there's a lot of resources for mental health providers that tag to like your insurance, and that might be another wonderful resource too. And I wanted to end with this slide, which is my favorite. Women, I would say one heart, many roles. We can do it. This is from Terrence Osborne, but it's a thank you for all the frontline workers who have been working endless hours fighting this pandemic, and just knowing that we're all in it together. And this one here is probably my favorite because it shows all the different roles that we assume, ranging from working, being a professional and wanting to and advancing in our careers, but also being at home, cooking, cleaning. I think there's probably too many hats to display here, but it's important to know and recognize that it takes a village. I want us to together be the village and empower and love ourselves through the pandemic, and even beyond. And I hope that some of the slides or some of the techniques through this presentation will help us and help you to at least check in and identify one or two ways that we can make some positive changes to get through this pandemic together. Thank you.
Dr. Shaw, thank you so much. It's Jack. I'm just going to jump in here because there's a little bit in the chat and we want to leave time for questions. So I'm going to move quickly. There's so much useful information, and we'll make it available to those who attended and are interested. But one question that comes up, if you could just comment, because you probably see this in the clinic, when folks are struggling with whether or not to be vaccinated, and sometimes it's based around their faith and sometimes it's based around uncertainty for other reasons, but where do you point people to sort of answer that for themselves as they wrestle with that? Or from a clinical perspective, how do you help patients with discovering different information about the vaccine?
Yeah, that's a great question. And I struggle with the word convince, because I think as a provider, even when it comes to treating hypertension and diabetes, I feel like my role is never to convince someone to do something. And when I'm in that position, I always feel like the overall outcome is not good. Like someone has to want to make that change within. So the bigger question is, how can we help individuals understand the risks and benefits and what may be in their best interest? And a lot of that is really understanding what their fears are and what their concerns are. And the concerns, some of them I alluded to in the presentation, may range from how it affects fertility. Is it going to make them sick? There's still so much we don't know about the vaccine, and really addressing those concerns. And what I tell patients is, this is the data we have. We have administered more than 300,000 vaccines. People have done well. The rates of hospitalization and the rates of death have come down. And if you're able to get it, to really understand what that may imply for you and your family. And so it is an extensive conversation, but to answer your question, it's understanding what the fears and challenges are, because it is different for everybody. And if we're able to really understand that, then we probably can do a better job at helping people get vaccinated if they choose to. And if not, then how can we help them stay safe and keep others around them safe? And that's where wearing masks, social distancing is extremely emphasized.
Great. And there's another question in here, and I think it's a common question right now, especially as people are anticipating a vaccine availability for some younger kids. How does vaccine affect kids' growth and development of little kids and babies and the littles, as you would say, and the boosters role? So sort of a two-part question. What is the impact of vaccine on kids? Is it different than adults in terms of what we know? And then talk a little bit about why we're talking about a booster.
Absolutely. So children have been actually doing really, really well with the vaccine. They seem to do better with the vaccine than the 30 and 40-year-olds. It does not affect development. There's no indication that that's a possibility. As I discussed, the mRNA vaccine, right now Pfizer is the only one that's approved for 12 and older. But the mRNA doesn't enter our cell. It can't affect our genetic code. It doesn't change our DNA. So in many ways, no different than some of our other vaccines that are required for school. We don't expect it to affect growth, development, et cetera. The booster, it's a great question. And part of that is us understanding the science and seeing how long the antibodies last in our system before needing a third dose. It's not uncommon for vaccines to need a booster. For example, hepatitis B is a 3 to 4 dose series. Hepatitis A is a 2-dose. Your DTaP is a 5-dose in our pediatric population. And so a lot of that has to just do with understanding how well our body is able to form a response and how long it lasts. So for now, for Pfizer, we have 2 doses given about 23 days apart or so. And the third one, the early data shows that our antibodies may start to decrease around the 6 to 9 month mark. And of course, that varies based on your own health and your chronic conditions. But we anticipate that around that 6 to 9 month mark, most individuals would benefit from getting a third dose.
Excellent. And I don't see it in the chat here, but I know it's something that I hear often in the community. So maybe we'll just wrap with this because I know we're about at time. There's a lot of discussion about if I've had COVID, which means I should have some natural immunity, then why is it important for me to get vaccinated? And so I think there's not a lot of discussion around even natural immunity wanes. So maybe if we can talk about that a little bit.
Absolutely. That's a great question. Between the vaccine and natural immunity. So we're seeing that natural immunity wanes as even immunity can with vaccinations. The vaccine seems to boost a greater immune response than natural immunity does. And so what we don't know is when you get infected, we think for the most part, up to 3 to 6 months, you may have some degree of protection, but it's difficult to identify or quantify what that degree of protection actually is. So the idea in getting vaccinated 3 to 6 months out is to help boost your immune system to prevent you from getting reinfected, which is a possibility. As we know, COVID-19, it's a virus, it mutates, you can get reinfected, but you want to boost your immune system to decrease the risk of that happening. The other thing we're seeing is that people that do have symptoms or are long haulers from their initial infection, sometimes getting that vaccination actually seems to help boost their immune system and assist in recovery. So those would be 2 reasons to, even if you have had COVID, 1, you're probably not going to have the immunity forever. And 2, if you have any residual symptoms, getting that extra dose may help your body recover faster.
Excellent. And then there's just one last one in here. Again, just a quick question to clarify. Pregnant women should be vaccinated during their pregnancy. Is that okay? Or where are we on that?
Yeah, you definitely want to discuss that with your doctor. It's safe to receive in pregnancy. The ACOG, which is the American Association of Obstetricians and Gynecologists, and the maternal fetal medicine specialists have found that the benefit in vaccinating outweighs any potential harm. As I mentioned, that we're not seeing an increase in the risk of miscarriages. If you're anticipating pregnancy, then it may be a good idea to vaccinate prior to pregnancy. And that's only really because sometimes we psych ourselves out. And if something goes wrong, we kind of find find ways to blame ourselves or, say it happened because of X, Y, and Z. But if you are anticipating pregnancy, you may want to vaccinate first. If you're not able to do that, it's safe to get vaccinated in pregnancy. As I mentioned, I did just about 2 weeks ago and about 35 weeks in now. And there is also data to show that if you are vaccinated in pregnancy, some of those antibodies may pass on to the baby, as we do in our 3rd trimester with our Tdap vaccine and our influenza vaccine. So those would be other reasons to consider vaccinating, but definitely discuss that with your primary or OBGYN if you're in that situation.
Wonderful. Well, thank you so much. And respecting everyone's time, I will turn it back over to the host team from here. And thank you, Dr. Shah.
Great. Thank you. Thanks for having me.
Thank you, everyone, for attending this workshop. If you have any questions that you would like to direct to Dr. Shah, or you would like to make an appointment or visit her Her contact information is listed here in the chat room. Also, you can always reach out to UCLA Health or to Jack. I believe her information is listed as well, or the city of Carson. But I thank you all, and Dr. Shaw, thank you for your time.
Thank
Please,
you.
everyone, resume the main link to take us back so we can have a little bit of entertainment and jazz, and then hopefully your name will be called as a raffle winner. Thank you, everyone. Have a great day.
Thank you.